Thank you for the invitation. Am I clear enough? Yes? Yeah, so the title of my presentation is From Fair to Fairer, and I thank Ellen also for the bridge, because I will also talk about fair in the terms of equity. But first of all, I also want to mention I don't have any conflicts of interest. I do want to mention that I receive funding from 3 different sources. First of all, we have the Dutch Federation of Medical Universities. They have the sector plan in Dutch. So they have received additional money, the universities, also the medical faculty, to accelerate healthcare. And one of the themes that is prioritized is data-driven innovation. And within this theme, the UMCG has also reserved funding on responsible implementation. So I think that's really great. Then second, also, I think many of you know Health Array. So of course, the UMCG is also participating in that. So we want to set up this national health data infrastructure. And also within the context of Health Array, there's also attention for the responsible development of this infrastructure. And finally, I have received funding from the NWO for the ELSA Lab Northern Netherlands, and ELSA stands for Ethical, Legal and Societal Aspects. And in this research, we want to contribute to responsible development and implementation of AI in healthcare. So maybe to start, so my work is on responsible data-driven research and innovation. And what is it? I mean, I think it's good to know. So you could say, in a nutshell, is that we want to do research and innovation that contributes to healthcare. And I added between brackets for all, because I think that is really the challenge, and that's something that I'm working on. And to make it a little bit more clear, so it's research and innovation which is in line with ethical principles. You can think about things like integrity, autonomy, transparency, equity, of course, but also in line with legal obligations and also in line with societal needs and interests, and that it promotes equitable outcomes. And how do I do that? Well, we investigate ethical, legal, and societal aspects that need to be considered, and we also reflect on how these aspects are currently addressed in different phases of research and innovation. And we try to promote the embeddedness of ELSA within research and innovation. And we do that via multidisciplinary research and always together with stakeholders. In the case of healthcare, of course, professionals and patients are then very important. And I'm glad that I'm here today because I think that the UMCG's Digital Competence Center has an important role for data-driven research because they advise researchers on responsible data collection and archiving and, of course, making data fair. But what is making data fair? So as also mentioned by Ellen, of course, fair data is meant to maximize the potential of reuse of research data. And the acronym, you all know it, is findable, accessible, interoperable, and reusable. But there's also fair data in another way, because what is fair? And my main takeaway of my message is that fair data is not sufficient to realize responsible research and innovation. Fair in the sense of findable, accessible, interoperable, and usable. Because fair data, in that sense, it is not always fair in terms of equity. And I therefore want to argue that we should focus on what I then mentioned, fairer. And what I mean with that is that the risks and benefits of secondary data should be distributed fairly or evenly. And before I go into that, I think it's good to show a little bit the roadmap of making data available for secondary use. Well, I think it started with the FAIR principles, which have been there for quite some while. And it's important to understand that this was about making scientific data available for research purposes. And of course, this has translated indeed to more obligations of paying attention to making data fair by funders of scientific research. In the meantime, what you have seen is that there is a lot of attention for data-driven research and innovation in healthcare, because it's seen as a possibility to, of course, address the different challenges we are facing in healthcare. So there is a push to make health data available, not only scientific data, but also data from primary care. And it's not only the idea that we make it available for research, but also for innovation. So the scope is broadened. Then we have different legal obligations. Since last week, we have the Data Act enforced. And this Data Act requires the providers of medical products, and it can be medical equipment that we are using here in the UMCG, for example, but also wearables that patients are using. And the Data Act requires the providers to give users access to that data that is generated with the products. So the professionals and the patients need to be given access to the data by the providers of the medical product. And also, if they want their data to be shared with third parties, they also need to do that. So I think that's good. Then we have the European Health Data Space, and Iris will tell you more about it. It's currently enforced, but we have some time before health data needs to be available. So in 2029, the holders of health data, such as the UMCG, need to make the data available for research, innovation, and also for policy. So again, you see a broadening of the purpose for which data needs to be made available. And that's important for my talk. Because how can you come from fair to fairer? There are a lot of challenges, I think, and I want to go into three. There are costs, it has been mentioned already before. There are a lot of data challenges, and also we have the problem that if we don't consider it well enough, there can be an unfair distribution of risks and benefits of fair data. First of all, the costs. Of course, making data fair costs time and money, and I think it was very nice that we already had a discussion, because it means an extra workload for researchers which are already overburdened. It's important to mention that, of course, it's being, supported that researchers make data fair, but actually it's a responsibility of the organization, also according to the EHDS. I don't know if Iris will say more about it, but I think that's important. So the organization should also support researchers in making their data fair. And that's, of course, also what the DCC does, which is very important. Second, which is important to know, is that when making the data available, data holders, they may charge fees for that. And it's not that you are allowed to make profits, but of course you can charge a fee which is, will cover the costs that you have to make for making the data accessible. The thing is that each country and institution may apply its own cost calculation methods. So we have no idea how that will play out. And if the fees are too high, then it will, of course, not be accessible for certain parties, and there's a concern for that. So there really is this need for EU-level guidance to harmonize these fees, to avoid also inequality of access for different countries and also different users, especially, of course, the public institution, the small business enterprises and researchers who have less financial possibilities to pay for data. And third of all, not all data is fit for reuse or has sufficient purpose. And I think it's really great that we as the UMCG, together with HealthRI, have launched a national guideline on this. It's a guideline for evaluating and also possibly terminating biobank collection. This is a QR code to the guideline. And what we say here is that you first of all have to consider whether certain data can still be used. Is there metadata, for example? Do we know what the data is about? Are there sufficient ethical and legal measurements? Is there consent, for example, or is there a different legal ground for which the data has been collected and can be reused? And is the biological material even sound? I mean, is it frozen in a proper way, for example? And is the purpose? What is the value of the data? Has it been used before? Are there sources to really keep the data? So that's what we did. And sometimes if it doesn't have a fit or purpose, then it's good also to terminate certain collection. It's important to consider. Second, as I mentioned, there are a lot of data challenges. This is a roadmap which also shows a lot of challenges it's in Dutch. It's just to show that there are a lot of challenges to make data available. And this is then in the context of AI for health, for the healthcare sector. I want to address 4. First of all, we need good quality data. We have to protect privacy, of course, mentioned very often. Trust and public acceptance is important. And I also want to mention dual use and misuse. First of all, Ellen, thank you also for mentioning it. Indeed, as Ellen said, carbon in is carbon out. Only if we have good data that will lead to meaningful results. That's of course the case for AI development, but also the case for continuing with certain data with new research. And the data can be incomplete, inconsistent, incompatible. So standards and uniformity are essential. And we are working hard on that, and I think that's really good. But of course, that also comes at a cost and a workload. And there are a lot of these initiatives going on, and I think that's really good. But that's just one of the challenges. Another one that I find important to mention is that you can wonder whether the available data is always the good of the right data. The data that is available is often not representative for all groups. Ellen, again, thank you for mentioning it. Indeed, in healthcare, we know that there is less data available from women, but also from ethnic and low socioeconomic status groups. So that means that if we have these biased data, that leads to biased outcomes. There are a lot of these examples also in the AI field that I'm working on. If you're training an AI model with data which is based only on white skin, and you're developing a facial recognition model, then it will work perfectly for people with white skin, but not for people with a darker skin, for example. And there are a lot of examples. So if we have fair data that is biased, then the research outcomes will also be biased, and that's not what you want. Secondly, there is no such thing as an average patient. And fair data focuses on making anonymous, mostly quantitative data available. But advancing healthcare, especially if we focus on this idea for all, also requires qualitative and is contextual information. And patients should not be reduced to data points. And already patients have a lot of concern about the digitalization of healthcare, a lot of data that's being collected. What does it mean for them and for the individual personalized treatment? The idea is that it can advance personalized treatment, but is that really the case? And do we keep paying attention to the individual person instead of the data that the person is collecting? And of course, as the UMCG, we have the idea that see the man, so see the person. That's an important principle for the UMCG. And I think that is remaining important. So we have to go look further than just the data that can be easily collected and shared. Another thing is, of course, protecting privacy, mentioned a lot. It is a challenge to ensure patient confidentiality and compliance with privacy and data protection. Fair data simply involves the risk of personal health data being accessed, linked, or re-identified. If we have weak anonymization or de-identification, this can lead to the disclosure of sensitive information, especially when data sets are cross-linked or combined. So the more data that there is available, the more risk there is of re-identification. That is just a fact. And we also have to keep in mind that unauthorized parties can gain access to data. And that's what happened also recently in our Dutch population screening program. And that has raised a lot of attention and a lot of anxiety also among the people who participated in that. So that's just important to be aware of and also try to mitigate these risks. And the awareness of privacy risk may also discourage patients from sharing information or participating in research. And that's important to consider because, of course, that's not what we want. And that also links to trust and acceptance. Because the secondary use of data for both research and innovation and policy that could undermine trust in healthcare because people fear misuse or disclosure of personal information. And that could be a reason for people withholding data or avoid care. And that's not what we want. It's also important to realize that the willingness to share data with researchers is much higher than the willingness to share data with companies or public authorities. even if data is anonymized or for research purposes. That's what we know. We also know that trust in research differs between social groups. Low socioeconomic status groups display lower trust levels, and that's again important. And again, this could lead to this biased data that we don't want. Finally, trust and willingness to share data could decrease further if commercial or research entities exploit data without adequate community benefit. And that links to the awareness of dual use and misuse. The WHO, they launched a few reports a few years ago, and they warn about the possibility that data, certain sensitive data, for example about viruses and bacteria, they can of course be used to develop vaccines, but they can, and treatments, but also they can be used for biological warfare and bioterrorism. That's not what we want. It can be used. Also, gene editing technologies, we're also working on here in the UMCG, they can also be misused for unethical modifications or creation of harmful organisms. We have to be aware of that. And the WHO therefore advises researchers to sometimes refrain from making certain data publicly available. And they also say that researchers should avoid sharing data that could directly facilitate malicious activities or pose significant biorisks, such as detailed information on how to engineer pathogens or create biological weapons. Another important example that I want to give, it's a little bit out of the scope of healthcare, but I think it's a really interesting case, and that's the case of Clearview AI. It's an American company who has developed facial recognition software, and it sells it to basically everyone who wants to use it for any purpose. They don't really care. And they have now a contract with the US Department of Homeland Security to identify illegal immigrants. And there are a few books written also about the development of this company. And what is interesting is that for the development of their software, data, and knowledge, they may just use of freely available open sources. And it's being written now very nicely in the books. That, they say, well, the data, algorithms, and scientific underpinnings, they were shared on media like GitHub and Archive. And what we sometimes do as researchers is that we add quotes like, please use this data information responsibly, or we disapprove the use of this data of information in programs that violate privacy and safety. But of course, we can't enforce that, and it's just there, so it's being used also by the developers of this software. And what was interesting is that when the AI developer of Clearview AI did not understand something, he was just reaching out to all the researchers, and we are just answering them. So I think sometimes maybe be also a little bit nice, too nice. Because I think we don't want to contribute to this with our knowledge and data. We want to benefit science and healthcare, basically. But this is, of course, what is also happening. What is good to know is that Clearview AI has been sued by many European countries because of illegal use of the data of European citizens, because they were scraping the data from the internet, which is not allowed. And of course, the services from this company are not allowed to be used in the Netherlands. I have a few minutes left, so I go a little bit quicker. So what can we do about it? How can we realize fairer data? There are 4 things I want to mention, and I will go through that quickly. First of all, I think it's important to do this benefit-risk assessment for making data available. That's also what the WHO recommends for sharing sensitive data, so when there could be dual use or misuse. But I think you can think about risk-benefit assessments for all available data. And I think an interesting example that is being developed by colleagues in Vienna is the public value assessment tool. And they developed a tool that can help assess the benefits and risks of data use. And they make a distinction between, okay, what's the value of the data, the public value, and what is the risk. And that's, I think, important to consider. Second, you can have certain requirements for accessing the data. I think that was also mentioned nicely with Ellen. There's this lock. Its access is not meaning open. You can have requirements for parties accessing the data. And you could distinguish in there between different actors and different goals, for example. And an interesting example, I think here, that's used by the Ada Lovelace Institute. They have developed an algorithmic impact assessment, and if there are, and that's a tool for accessing the possible societal impact of an algorithmic system. And this completion of this tool is required before access is granted to the National Medical Imaging Platform. So I think that's an interesting example. I also find it important to mention that data solidarity goes both ways. So fair data is mostly about making data available for research, and now in the sense of secondary use also for innovation and policy. But what about making the data, or let alone the outcomes, available to the people who contributed to the data, the patients? Of course, we're also working hard on primary use of data, and that's also important for patients, because they sometimes feel exploited or treated as mere test subjects or research guinea pigs, onderzoeksvee. Very often research results are not shared with the research participants. Yeah, we share it in academic publications, but that's not what the research participants read. Well, many may benefit from receiving the results. And I think it's interesting in that sense that also we as the UMCG just have approved a guideline on handling incidental findings. But sometimes in the research that we can do, there can be unexpected discoveries of a medical or health-related condition that is of importance for the patient. And it's important then to consider whether it's good to report that back or not. Finally, it's important to know that data from one group can be used to benefit or discriminate other groups. So data solidarity is not just about pushing patients to share their data for the public good, but also that to recognize that data-related benefits and risks need to be shared collectively by society and not just by individual data subjects. Finally, I will mention it very quickly, but of course the environmental footprint also plays a role. All this data that we collect and store and process, of course it costs a lot of energy, water, carbon emissions, and also the EHDS, they consider it, but there is, I think, little consideration, and it should be taken into consideration in this cost-benefit calculation. To round off, I think in order to fair data to really help us getting a better future, we need fairer data, because fair data has benefits, but also many challenges, and it does come at a cost. So for realizing better healthcare for all, making data fair is not good enough. The focus should be on making data fairer. And by focusing on a collective and fair distribution of risks and benefits of secondary use, fairer data will be a better future for all. I would like to thank you for your attention. And if you're interested, the very final one, Jetse, want to know more, in October we have, I'm just going to pitch my own, sorry for that.
Yeah, that's fantastic. Go for it.
We have a hybrid event on medical AI and inclusivity. So if you're interested in the topic, you are more than welcome to come, and you can scan this QR code. Thank you for your attention.
From fair to fairer, the feeling I also got based on when we were talking about metadata and the last presentation, that's a lot of work for an already overburdened group of researchers and clinicians. To me, to say it bluntly, it feels like even more. I agree that we need to make it fairer, but how can we, well, how can we make it manageable, that we can actually do this? Because it's a lot of work and a lot of effort and a lot of knowledge that needs to be put into this research.
That's true. Yeah, and therefore, and then maybe we can also look at the funders again. But I think also in research and AI development, what you often see, and also in AI development, it's very often it's about the technical side. So we want to understand science. We want to understand how we can develop certain AI technologies.
Yeah.
But that alone is not enough. We need to work together with the people who are going to implement it, people who focus on the responsible side, so the ethicists, the legal people, the research support. So I think it's important, and I think that's done more and more, that this societal impact is being mentioned and that money is reserved for that. So that no longer you could just do something in a local, isolated research or innovation, but that it needs to be embedded and that attention is being paid to all these aspects. And then I think together we can come further.
Ellen was like, yes, I want to answer this.
Well, you just said we want the funder perspective. I don't know if there's any other funders here. It could be, actually.
Funders?
No?
Raise
Okay.
your hands? No.
Well, I guess 2 points. One is, if you're only doing open science because your funder wants you to, you're doing it wrong. Like, you should be doing good science because good science is what you want to do as a scientist. And obviously, as a funder, we make things mandatory because we want it to be the norm, even if it's a little more difficult. But saying I'm doing open access or open science because my funder wants me to is like saying I don't commit murders because it's the law. Like, maybe just make good choices. Also, your comment about how are we going to do this?
Yeah.
We are doing it.
Good.
Like, it's step by step, but compared to, say, 5 years ago, fair data has become so much more easy, so much more normal for people. So I do have a feeling that we're here and everyone's like, oh, for a lot of us it's new, but there's a lot of good things happening already for the past few years. So it's step by step, but I am really positive about it that we're getting there already.
Good.
Someone else?
We have time for one more question. There in the back. That's
Never
great.
gonna
I'm going to
make that.
throw it. Yeah,
Can we go
let's
in
some
2
audience.
steps?
Yeah, all of you. Let's bring the cube up to the woman over there. Yeah, that's great. Collaboration.
Yes, my name is Shanti Devi from nuclear medicine. I saw from your presentation it was stated that data holder may charge some cost for data access. Here, I would like to ask if there is a regulation about charging data access and how to prevent as if it is like selling the data itself, so that we are still in, let's say, in a good shape of maintaining the data.
Yeah, I didn't get. Am I correct that your question is if there are certain guidelines for the?
Yes.
Yeah. So there is. I don't. Do you say something about it, Iris?
Sure. Yeah.
Sure, but yeah. So it needs to be transparent, and you need to account for the costs that you are going to ask, and you are not allowed to make profit. So it's not indeed about a new business case selling the data. That's what private companies, of course, do. Be aware of that if you're going to indeed do a direct-to-consumer test. But that's not the case in healthcare. That's really not the case. This is not about making money. It's really about, sharing our knowledge and trying to improve, research and health.
About covering the cost that you can actually
Yes.
share instead of that it would actually cost the organization.
Yeah. But still, then it's difficult, as I mentioned, because there will be difference in that probably. Yeah.
From fair to fair. Can I have a warm round of applause for Mirjam Plantinga?